Welcome to the office. Welcome to the office.
Thank you.
Nice to meet you.
Nice meeting you too.
Okay, so you're here for a couple of things. Yeah? What are the top 3 things you're here for?
Basically my back. I think I'm getting a little scoliosis on my back.
Okay,
I have problems with my lower back,
yes.
with my neck, both knees,
Okay,
and I have a problem with digestion too.
okay.
I have problems. I cannot sleep at nighttime, and I used to be very active, and now I cannot even walk.
What do you mean you can't walk?
I cannot even exercise or go hiking. I used to go hiking, and then now I can just barely walk.
Okay, we have some work to do. We did go over a lot of your stuff earlier, okay? But I know you want to share this because it may help some other people. Madam, you've been through a lot, I understand. You've spent most of your life taking care of everybody else, right?
And I haven't been working for 2 years.
Because of the pain? Because you can't walk? And when you walk, how long after you walk does it
It's
start
just
to...
I cannot be on my feet for more than 2 hours because I have a lot of pain and I have to go lay down.
Lie down? For how long before you can get back up?
Maybe an hour or so.
Okay.
And I'm on pain 24/7, so I have pain all the time.
And what are you doing here?
Getting fixed.
Well, let's get some answers, okay? We did go over your x-rays. I may go over them later at another time if we're going to share the x-rays later. We do have some things going on in the foundation. Actually, maybe let me just do a quick peek of your x-rays, okay? Mm-hmm. This is a picture in time. It tells us how she's evolved from birth. When we looked at her side profile, she does have the curvature. We do have a little extra sway back in the back. But let's go over this x-ray here on the foundation and see what we find. And there's some significant things here, and I am going to have her do other testing. When we look at the overall presentation here, the first thing is what? There's a lot of bad digestion going on here. We have a lot of undigested food. She's not absorbing and assimilating. I don't see the Blvd as I like to. As we now zoom in to it, you can see a couple of things going on here. You can see that there's a pubic bone injury. The right side is slightly lower than the left. The sacrum is bent and tilted. And that's the start of this imbalance in her body. As we go up, the short leg on the right and the rotation on the right is causing a little bit of this curvature issue. I don't like the word scoliosis, but there is a right curvature in your spine, okay, ma'am? And as we're doing that, we can also see there are potential low bone density signs or osteopenia. So we're going to send her for a bone density DEXA scan. As we go up, we start to see flailing of the ribs here. We start to see calcification, so we need to rule out if there's any gallstones, kidney stones, or is that just calcification in the ribs? We're starting to see it here as well. When we start to see calcification and flailing of the ribs, we need to rule out the thyroid, which will also contribute to overall body pain that you were having, right? Mm-hmm. And one of Dr. Gonstead's secrets, or he had 2 secrets. Mm-hmm. Number 1, ice for inflammation. That's the secret for inflammation. Ice. Okay? Ice the areas where the inflammation is. Number 2, overall body pain that doesn't resolve. Check the thyroid. Those were his 2 secrets, as was taught to us. Okay? Now, so we need to rule that stuff out. Okay? As we go here, you can see the curvature go up. And as we're getting to this part of the body, what's it doing? It's compensating. But then something happened in here causing it to kink to the left. And then the body wants to do what? Immediately kink back to the right. So you have a lot of compensation things going on in the body, ma'am. Okay? Mm-hmm. Now, as we get to the top, this is another injury. This relates to your neck. T1, T2. We have a T2, T3 side slip. So it's actually slipped to the side. There is some injury, whether it was the fall, something got hit on the back, something happened. But it's so that's part of what's causing the shoulder to go up on that left side, right? So you have that imbalance. And a lot of your imbalances are starting structurally, ma'am. So that's the good news. Okay. And then there is a jaw deviation. We'll deal with that stuff later. Okay. That's not your primary issue. Okay, my dear? Let's get started. Let's walk, please, towards the nervous system poster. Your regular walking, however you walk. This is your walk, madam?
Yes.
Okay, turn around, please. Be careful of that table. Just walk whatever's normal. Your hands on the side, however you want. Go over, and I want you to touch the nervous system poster, ma'am. So she's just going side to side. There's no real step in her gait. Okay, madam, come back over here. Can you lift your pants up for me so I can see your ankles when you walk, please?
I'm so glad that they cannot see my face.
That's okay.
Embarrassed.
For what?
Of my knees.
Just walk. Walk. So her knees do knock. Turn around. Keep walking, please. Just regular walking. Yeah, so those knees are knocking together. Part of those knees knocking are coming from the sacrum.
And they're getting more.
Yes, that's coming from the sacrum. I've had many cases like this in the past. Keep walking. Don't stop. Turn around. Just keep walking. So her gait is off. She actually threw her upper cervical out first, long time ago, based on her walk is what I'm seeing. And she has bilateral toe out. If it was just the sacrum issue, it'd be bilateral toe in. We're going to first start by running the meter down your spine. Let's get an overall look of the spine. We can see how the spine deviates, and it kind of matches that x-ray. It goes like this. Okay. Now, swelling. Most of her swelling is there. That's swelling. Okay, this is all swelling. Swelling, swelling. Starting at the base of the neck, head down, please. And the first thing we're getting is up top in the atlas. C1, left side. So apparently we got some guys outside. They're painting the building. Sorry, there's a little distraction in the back, okay? 20 points, C1, left side. Very good. This is old. 5, 6 points, T6, T7, left side. And all of this is starting down right there, madam. S2, S3, down in the tailbone. There it is. Okay, let's statically palpate. As I'm running the fingers down the spine, you can see right there is where the swelling starts, puffiness. It actually gets that orange peel right there. More right there. Starts again there. One, 2, 3, 4, 5, 6, 7. More tender when I push 6 or 7?
6.
6. You have a very high pain threshold, Eddie. You've been dealing with this long time. 6, 7. Okay. Scoot forward, please. Let's check the movement in your pelvis. Scoot forward. Para al frente. Feet together. Open and close your knees. Open and close, please. Open and close. Good. Left side only. Do the left one only. Right side only. This is the sacrum on the right. Scoot back for me, please. Back slowly towards me. Número 5. This is S1.
Oh,
But
yes.
remember I showed you on the x-ray. That's the spina bifida.
Yes.
That's not the cause. We got to go down one more. S2. Duele? S3.
Oh, yes, too.
S2 or S3 more? Dos
Oh,
or tres? Tres.
that one.
Tres. Uno más. Cuatro? No. Tres. Okay. S3, T6. You with me, lady?
Yes.
Let's continue, okay? Let's go to the top and let's check your neck. Now, we need to go S on the left side, C1 on the left. Right side is not as bad, correct? Look up and down, up and down, up, right side, left side. That upper cervical doesn't want to move, lady. Right there. C1, C1, S3, and T6. Those are the three majors where we're going to start. After we do that, I'm going to actually work on your ankle today, not your knees on the first visit. And the reason why is we need to see how the foundation affected the knees. Okay? All right. Are you ready?
Ready.
Let's do this. Face down over here, please. And I want to share one thing actually before we start. Because you said treatment, right? And people talk about chiropractic treatment or manipulation treatment.
Yes.
And I want to explain something, at least the way I do it and the way it was taught to me. I'm not giving a treatment, okay? I'm doing a procedure. And it's all based on a very specific philosophy, the chiropractic philosophy, that the body is designed to be in balance with nature. When there's interference between brain and the rest of the body cannot possibly function at its optimal best. The nervous system controls every function in the body, directly or indirectly. Why is that important? Okay. When you go for a treatment, right, anywhere, for any treatment, the idea is you're going for this thing, and whatever is done to you, you're supposed to feel good when you leave. That's treatment. What we're doing here is we're doing it for the patient, not to the patient. And what that means is, what am I doing for you? I'm helping you get the pressure off the nervous system and helping you get back in balance. I'm doing it for you. But the idea is you are doing the healing, not me. Are you ready to heal? And people ask is, how do people respond to this treatment, right? And they'll say, well, how am I going to get better? And this was taught to me a long time ago, philosophically. It all depends on the liver within. Not the organ, the liver, the liver, the live person within. You want to express, does that live person want to come out today?
Yes, definitely, okay. Yes.
Then we're on the right page. So I'm doing for you, not to you. That's the difference between getting a treatment and getting this procedure. Does that make sense?
That makes sense to me.
Face down, please.
Okay.
Turn your head to the left. Left hand here, please. Left hand here. Let your elbow hang down, please. Now, turn this way a little bit, a little more. There you go. Bend this. Are you okay there?
Yes.
Good. Gotcha. Head down, please. A little bit more. Left ear, left atlas, C1, ASL. Good. There you go. Let's go back on that table, please. Let's do this. S3. Now, we said on the x-ray that the hip is slightly down on the right side, correct? One of those tres. We're going to be on S3. We're going to torque counterclockwise to help get that lifted up for you, okay? Breathe and receive, man. Palms up. And that's the home run. I gotcha, lady. I gotcha. Thank you, Shasha. I couldn't let you think too much about it. Número 6. Número 6. Número 6. Número 6. Caramba. Hold my hand. I got you. March in place. March in place. Look at me. March in place. Let's go. ¿Qué es diferente, señora?
Menos dolor.
¿Sí?
My knees are not feeling much pain.
Keep walking.
Wow.
¿Qué es diferente?
Yeah.
Seriously.
I mean, less pain.
Keep
I
walking.
couldn't even walk.
Can we test one more thing, please?
Sure.
Can you sit on the floor against the door here?
If I can sit down?
Yeah. You don't know how to sit?
Oh, I can. I can show you my tricks. How am I going to be sitting?
Use this if you want to hold on to, but sit on the floor.
Okay.
Sit on the floor. Okay. Was it different to sit down?
I haven't been able to sit down because I've been having so much pain on my knees that I cannot even sit down in the lower places because it's very hard for me to stand up.
Well, stand
the pain
up.
on my knees.
Stand up now. Let's see.
I have to use my tricks.
Madam, hold on here.
Yeah, you know how I normally get up? This is how I get up because I haven't been able to get up the other way.
Was that different?
Yeah, a little less pain.
Come back over here. Let's continue. That wasn't so bad, was it?
Mm-mm.
We had 20 points, 15, 20 points. We're clear up top. Right back is clear. Most important is this foundation in terms of the pressure and how it's moving. And guess what, lady? Cero.
See?
Sí. Mira. Check it out. Come back slowly towards me. Número 5. Número 1. You remember? This is tender,
yeah,
but different. See? Número 2.
Yes, tender.
Número 3.
Better.
Better?
La dos, I do have pain. Yeah, right there.
Starting
Ay,
at 3.
ay, ay.
Okay, no problem. Not bad. Can I continue?
Sure.
All right. Let's do the ears. Let me do the work. Come close. Shoulders. There you go. And I'm just tracking of your patella. I'm not adjusting your knees, okay? Can I bend it? Can I bend it? Is that okay? Sorry. Say when.
Hasta ahí.
Say when.
That's it.
¿A dónde? Got it. Okay. Other side. Lift it up your leg. Let me do the work. This side's definitely easier.
Better.
See?
Lately, I haven't even been able to put my socks good on this leg.
Duele? Straighten this leg out. Duele?
Less than that. Yeah, that one, yes.
I'm checking the knee. Let me do the work. I want a little more of your sacrum. Let's go back down here. I was down on S3.
Mm-hmm.
I'm gonna go slightly to the right side of S2 to get a little more of the rotation. Okay? So what I'm doing now is the left knee actually feels better. Uno, dos, derecho, aquí. So we're torquing. I'm leaning over a bit to get a little bit of that rotation out. PR, respire. Poquito. That's it. I got you, lady. Excellent. And come off slowly, please. Raise your legs. Now let's go on your back and then we do one more thing.
On my back.
Okay, boca arriba. Raise your right leg, please. Let me do the work. Mira.
Nice.
Más. Do it yourself. Okay. Now, let's do this. Bend this right knee, just like that. I'm just going to do a little machine work to start breaking up some of that scar tissue, okay? We're not touching the knee yet. You can straighten up the other one. Come up slowly. Let's walk it off. And tell me if anything else has changed.
Pain.
Huh?
Pain-wise.
What about the pain?
Almost gone. Pain-wise.
Pain-wise, okay.
Yeah. I
Fair
couldn't even put my feet on the floor because I was having pain. And now
You can walk a little
I
bit.
can walk. I feel like it's me, like getting happy now.
Bueno. What you're going to do when we're done here, you're going to go walk for about 10-15 minutes with an ice pack
Okay.
on your back. Come over here, please. Let's do your hands. Right over here, please. Squeeze. Squeeze. You got a little bit on the elbow here. Less. Turn. Okay, raise your left leg. Hold it, right? Just hold it up a little bit. How is that on your right knee?
Hardly no pain.
Raise your right knee.
More than that.
I don't need you to go so high. I'm just seeing the pressure in your knees.
Okay.
So even just this much.
Oh, okay.
Poquito.
Mhm.
How is your left knee when you do that?
I feel more wobbly.
This is
That
part
one.
of your homework, okay?
Mhm.
Standing on one leg for 2 minutes, eyes
Okay.
open.
On each leg.
Yes, ma'am.
Okay.
Mira.
Mm-hmm.
Other knee.
Increíble.
Awesome. Squeeze. Squeeze. We have some homework. We talked a little bit about it. Water walking ice. Backwards pedaling for the knees. 2-to-1 ratio. 10 minutes forward, 5 minutes back. Pedaling backwards, no resistance. If hurting with resistance forward hurts, you don't do that either.
Feeling better.
Okay.
Siento mucho mejor. I'm feeling better with the first time. I'm happy. I came here crying this morning and I'm happy now. Thank you.
I appreciate it.
Thank you so much.
You take care of this. God bless you. Dios los bendiga.